Hello, I am Dylan Willard, and today I am talking with MCHS Principal Dr. Edwards to get the latest on COVID and quarantine. Thank you for joining me today.
Glad to be here.
How has the school year gone so far?
I have been overwhelmed with how well the students and the staff and everyone has done coming back to school with COVID being around, because could have proved to be very difficult, but everyone's made it really easy. And I will say this, if anyone had ever said to me that these items, a mask and 6-foot piece of twine and calendars and all that were going to be a big part of our tools of every day, I would have thought they were a little crazy, but they're a part of our everyday world right now.
When you and the other administrators returned to school, were you aware that there would be students who you needed to quarantine?
We did predict that because we have been following and watching the Department of Public Health and CDC guidelines throughout the summer to learn about how the guidelines would go. And so once we realized that within 6 feet for more than 15 minutes was going to be a big part of what we had to look at, we did expect that there would be some. I think what makes the work interesting is that how fast we have to do it sometimes to do some of the contact tracing, but we did predict it. I just think realizing how much effort was going to have to go into it was a little more than we expected.
And something I'm not really clear on is contact tracing. How does that work?
Okay. And I know that this has been confusing to people, but contact tracing really boils down to once we receive word that someone has tested positive for COVID, we start with a calendar, and we start with the date that that person tested positive. So let's just, for example, say maybe the 12th. And then from there, we have to determine if that person had symptoms and all this. We have to go back 48 hours. And we have to find out who would be considered close contacts of that person. And a close contact, y'all know, is defined as being within 6 feet for more than 15 minutes of someone. And so that means we go and we have to look at how did they get to school? Did they ride the bus? Do they come in a car? Who are they in class with? Who do they eat lunch with? And once we determine that they were in that definition of close contact, then the contact tracing means we begin pulling those people in, contacting their parents to let them know that their student's going to have to be quarantined out for 14 days. And so that contact tracing, when you hear us talk about that, we're finding out where the student was, and then we're verifying that too, not just taking it off of somebody's word.
And how are you ensuring that the right students are being quarantined?
So that verification is one thing. One of the great things about working with high school students is that they can tell us, like, okay, so this is who I normally sit with and things like that. All of our teachers have to have seating charts, and all of our teachers have the cameras running in their classrooms. We're not watching those live. It's something that, let's say, for example, we need to verify somebody said that you were within close contact. We will actually ask that teacher for their seating chart, and sometimes we do take our 6-foot piece of twine to go in there and kind of measure to make sure that we're getting close there. And then we will use the camera if we need to see how much time was spent. And so that's where, and the cameras have also come in handy at lunchtime. Again, we're not monitoring the cameras. We're not like sitting there watching. But if somebody says this was somebody that I was sitting with, we can actually go in and say, okay, so they were there for 20 minutes with that student. And that's how we verify it.
And I imagine some students have liked the idea of taking advantage of being quarantined. Has that been the case?
We've had a few students do that, and I think what is most irritating about that is that, number one, it takes a lot of work to verify, and then number two, it's also, they're putting themselves out of school for a period of time that's going to be difficult for them to catch up, and what if they come back and then need to be quarantined for real? So it's something that don't create more work and keep themselves safe. So.
When someone gets quarantined now, what is different from the spring?
So back in the spring when we were all out together, we were trying to figure out who needed to do what as far as school, how we could get things done. We're able to be a little more organized with that now. So if for example, you got quarantined, you need to know that all of the work that is continuing to go on in school is going to be expected of you when you come back. And so you're going to need to keep up with your work. You're going to need to make sure you're not waiting till the last days before you come back. Our teachers are working extra hard to be sure that they're doing Google Hangouts with kids if they have to, and working to keep people caught up. But the other thing is, now that we're dealing with a specific quarantine, if you're quarantined out, you don't need to be out socializing. During that 14 days, you really do need to keep yourself at home, keep yourself away from your family members as best possible, but don't go out, no pool parties and things like that. The sooner people will take the quarantine period a little more seriously from the social aspect, I think the faster we can get away from having to do it all.
And what are some things students should remember if they are quarantined?
If they are quarantined, they do need to be aware if they think they're going to develop any symptoms, if they do start feeling any differently at all. We have had people, once they're quarantined and they decide to go get tested, it's recommended that you're not tested immediately. Wait for several days after that date of contact with that person, so that would give a test an opportunity to show. Also, and to stay in contact with the school. We're keeping a lot of records on all of this, because if you have a positive test, or if you ended up with the antibodies and you were exposed to somebody else, you wouldn't have to quarantine out. So staying in touch with the school and through our school nurses would be, this continues to be a big help to us.
I've heard that you have to watch the videos of students who were in class and were quarantined. Why do you guys have to go so in depth with that?
We want to be sure that we're not quarantining more people that need to be quarantined, number one, but also that we are letting people know who really were in contact that has been verified. That's been something that's been very important to people, so that they know for sure that they have to quarantine. And so that verification has been very helpful for us. And it's also information that a parent needs, or you might need. For example, if you do develop symptoms, you would be able to say to a doctor's office, I know that I was exposed on this date, and that's what's very helpful.
Why do the teachers and principals care so much about us wearing our masks?
That's a great question. So the mask, as we know, and everyone has talked about, they're not necessarily going to prevent you from getting it, but they are going to help us have a better chance of you not getting it, and for someone who is positive to not spread it. And that's just our biggest thing. We're really trying to do basically infection control is what we're doing. And so that's really important. The one thing, and I get student concerns about this as well as some teacher concerns, there's people who want to wear their mask under their nose, but I want you to think about it this way. When you go to get a COVID test, for the most part, they're going to stick a giant swab in your nose, which that means that's where all the cooties are. So if you are going to not wear your mask here, this nose area is where that virus can live. And so we want to be sure that you're wearing masks correctly.
I bet now is a tough time to be a school nurse. How are they being used?
So I can't say enough about our nurses. Y'all know that Nurse Hope and Mary Ellen Ramsey are just amazing in what they do. Both of them are very big on the research piece of this. They're keeping up a lot with updates that we get. They're doing all of their normal nursing duties that they do with all of our students, but they're also one of our #1 points of contact for students who need to be quarantined, and all the documentation. We're keeping a giant spreadsheet with all of this. And so they're doing a lot of parent phone calls. They're working with students a lot. So they are really putting in a lot of extra hours right now.
And finally, last question. What are some things we can do to help you?
Again, and I can't say enough about our student body and just how great they have been through this whole process. I just ask that they continue to do that. The minute we think we can back off of anything, we will. But until then, we need masks on in all the mask on zones. We need the social distancing. I really need for you guys to stay apart as much as you can. Nothing is more disappointing for us to have to quarantine someone. Maybe they've got an athletic event or something like that coming out that they're going to miss because of quarantine. And the quarantine days of 14, that's not something that I made up. That's not a county rule, a state rule. That comes from the Department of Public Health and the CDC. So, I've had a couple of parents call me and say, well, can't you just cut their days short? I can't, and I'm not going to, because we really want to do everything we can to keep y'all safe. Y'all continuing to work with us, mask, social distancing, and communicating with us, I think are some of the biggest things that you can do.
Thank you for your time. Is there anything else you feel we should know?
I would say, go Dogs. We're going to figure this out. We really will. It's going to be a different school year, but as always, if Morgan County can't figure it out, no one can. And so I just hang here with us. We're going to get it figured out.
Again, thank you for your time. Have a great afternoon.
Thanks for having me.